Kardashian was introduced to me by Shar. She's an esthetician. We worked at the same office in our Rodeo Drive, Beverly Hills clinic. And Khloe has a growth on her cheek that's been there for 7 months. And she wanted me to examine it and see if I could treat it. When I looked at it, it was skin colored, and she posted a photo of this growth. And so you can see it's skin colored, but when you touch it, it actually was hard and it was, pretty big, and it was not going away after 7 months. And so I was concerned that it could be something dangerous. Khloe also revealed that she has a history of melanoma when she was 19 years old. And so for those people who have had history of melanoma, there is an increased risk of recurrence and also of new melanoma. So I was very concerned. And so I told Khloe it's best if we do a biopsy. And so I'm glad that she agreed for a biopsy. And so I took a sample, just the very top layer of the skin, and sent it out for pathology. There are different types of skin cancers. Melanoma is the type that we really worry about, and especially for younger people, because melanoma, if you leave it alone, it can metastasize, which means it can go to different organs, and it really can kill people, and even young people. And so usually a melanoma will start off as a pigmentation, a new pigmentation, or it also can be a pigment or a mole that you've had your whole life, or a birthmark even. And if it's changing, it can have these cancerous types of changes, and then it can become a huge problem. Excessive sun exposure, if you have a history of sunburns, that increases your risk for any type of skin cancers. If you have a family history of skin cancers, that also increases your risk. So we know those factors play a role. Also, your immune system definitely plays a role, because those who are immunocompromised or are taking medications that suppresses their immune system, like those who have had transplants, their risk for skin cancer is much higher. I tell patients that anytime you have a brand new spot, anytime where you have a new growth, or anything that is changing in your existing moles or birthmarks, really show it to your trusted dermatologist. Find a dermatologist. Dermatologists are trained to be able to look at, if something is small and nothing to worry about, or if it's something major, like Khloe's, that we should take a biopsy so that we can find out exactly what it is. And then if we need to, we can remove it right away. So excision or surgically removing the skin cancer is really the mainstay of treatment for a majority of patients. There are patients where if they have so many skin cancers, in one location, or if they're elderly, or if they're on a major blood thinners, then maybe radiation might be better. Or if it's in an area that if you remove the large amount of skin, you won't be able to close that skin, sort of like the nose or maybe around the eyes. So sometimes, radiation or chemotherapy is used. So after a skin cancer is removed, then you usually have an area that has to heal. And usually you will have stitches put in there. Sometimes they have to be removed. Sometimes they will naturally dissolve on their own. But you have to take care of it. You cannot expose it to the sun. And usually that can take weeks that you're taking care of it. And that is why Khloe has been seen for many weeks with a bandage, a Band-Aid, and she's covering that area. And that's very, very smart. And that is what we tell our patients. That is for better healing. Once that heals, then she will be left with a scar. And everybody heals, from surgery different. Some people will scar better than others. Us Filipinos or those with skin of color, we tend to develop larger and thicker scars and even maybe keloids. and so that can be a concern. The good news is that we definitely have a lot of new technologies now to address scars. So even with Khloe, once that scar is formed and that area is ready, we can do some laser treatments and other treatments to really make the scar as good as possible and not as visible. Number one is definitely protect your skin from sun exposure. This we know. So wearing sunscreen that covers both UVA and UVB, and that's what we call broad spectrum sunscreen. We wear our hats, wear your sunglasses, seek shade, cover your body, because especially if you're going out to the beach or you're going swimming, there's no such thing as a true waterproof sunscreen. So if you are gonna be in the water, you really need to reapply your sunscreen. And don't forget areas like your neck, your chest, and for guys, the ears. There's a lot of skin cancer in the ears. And if you're, kind of thinning up there, also your scalp. Surreal. When I do my job as a doctor, I always do my best for every single patient, not just my celebrity patients, obviously. And I am bound by patient confidentiality, so I never share unless my patient specifically has given me permission, or like Khloe has come out on her own and identified me as her dermatologist. And so it was really an amazing surprise. I was actually doing work at my Rodeo Drive office that morning, and then oh my gosh, it was there. And then it was crazy. I'm so grateful to Khloe for being so open about her skin cancer journey. It certainly has raised a lot of awareness about skin cancer, about getting your skin checked, even as a young person, and about our role of dermatologists in all of this, and that I really feel like she's done a lot. I just want to greet my kababayans and fellow kapuso. Happy Filipino-American History Month. And this thing that's happened with Khloé Kardashian, identifying me as her dermatologist, and America's favorite dermatologist being a Filipina, I think is a wonderful way to punctuate, this month and all the great work and contribution that we as Filipino Americans have made. And so continue doing great work. Mabuhay. You do have, a new growth, or you want to be seen or evaluated, we definitely can make that happen. And then, of course, I am on social media at Dr. Tess Mauricio on Instagram. So you can message me there as well. You can email us at info@mbeautyclinic.com. And of course, you can, watch our show on GMA Pinoy TV, season 5 of All in the Family with Dr. Tess. We're really excited about that.